everyone, welcome to this episode of the Physio Crew TV. Today we're going to be talking about assessments when you come in. We're going to be talking all about the knee. So we know that it can be quite frightening for patients when you first come in. So first of all, I'm just going to ask Stuart then. Stuart, what would you, when you sort of bring a person in if they've got knee problems, what's the first kind of questions that you're going to ask them?
Yeah, so initially what we're going to do, we're just going to ask for your story and sort of when it happened and what's happened. So we're looking for that mechanism of injury and pretty much how it's happened and when it's happened, how long you've had it for, and kind of go from there really.
Cool. And Camille, what would you, is it important to know sort of what they're doing for work or what? So Stuart's kind of taken us straight in there. I think that's great, Stuart. We often will ask them, you know, the type of pain, how long they've been experiencing it from, how important is the mechanism?
The mechanism, so the mechanism is really important. So we've got quite a few structures in and around the knee. So we'll want to work out exactly how it happened. So if you know that, for example, you were playing football and you kind of turned, your foot was fixed and you turned and twisted, that might lead us towards an ACL kind of injury. If you think there was no trauma, so no one kind of went into the knee or anything, it's just giving way, which we hear quite a bit, then we're looking more towards like muscle weakness. So it's not something necessarily that's been damaged. It could be more just something of a muscle imbalance. Sometimes people might say how else they had, and it could have come on over quite a long time. So again, as Stuart said, we want to know a bit more about that pain and how long you've had that for. Is it something that's crept on after a while, or is it something that's happened quite suddenly? So yeah, I think it's quite important to work out
the mechanism.
Yeah.
Because I don't know about you guys, but I kind of see maybe like three main different types of patients. So we kind of get our bread and butter because we're sports specialists. So we see a lot of athletes. So those are the ones that kind of tend to be traumatic, maybe the ligament sprains, tears, maybe ankle injuries as well that are associated because perhaps there was weakness at the knee. So I think we're kind of seeing those athletes, whether they are rugby players, football players, people who have got turning injuries, something like netball as well, very prevalent. And then we've got kind of the weekend warriors who are a little bit older, who are just doing it, you know, working in office 9 to 5, and then the weekend maybe just overstretch something. So those are your kind of more overuse ones, maybe something like a patellar tendinopathy.
Yeah.
And the last sort of patients, I guess, are going to be, again, those people who are arthritic. So got these kind of myths that they think that they shouldn't be doing anything, whereas actually they need to get fit and active. Can you give us an example of a patient that you've seen before with knee pain and what kind of things you found helped them?
So I think that'll probably be a patient that so I see quite a lot of patients that have had knee pain through and that's generally from arthritis and things like that as well. So with that, the best thing that I've sort of found to help them would be things like regular movement of the knee itself, and then also things about pacing as well. So it's all about sort of, especially if we're giving them exercises, rather than doing things all in one, spread them throughout the day, and people find that really helpful, because a lot of the time as well, if you're given an exercise, given a sort of a bank of exercises, a lot of people think it needs to be done straight away and all done in a one as well. But no, if that's spread out throughout the day, you'll probably find that you'll be able to go for a little bit longer and it doesn't tire you out for the whole day as well. And I find that quite useful in quite a lot of patients actually. So that's been quite good, especially with patients that have got arthritis and
allowing them to push themselves as
yeah,
well.
yeah.
You know, like you're saying, the pacing is really good, and saying to them, actually, you know, this is safe to move. You know, you're not going to do any damage. Going up and down stairs, you know, doing little step-ups, those kind of things, doing your bridging, doing your hip abductions, things where we're looking at the control around the pelvis and around the knee. I think that's very very important. But I know your poor elderly patients, they love getting back to doing a little bit more walking and back to the things that they love. Camille, have you got an example of somebody that you've seen who's benefited from some kind of exercises and some treatment?
Yeah, so I quite often get some kind of anterior knee pain in people that have, it's fairly specific towards the front of their knee, so, and it tends to be aggravated by more exercise, and I tend to find that it can be caused, if it's not more to do with a tendinopathy, It's often caused by muscle imbalance, so if they have overactive quads, for example, and perhaps weaker hamstrings, then being able to test both of those muscles and to see whether they're at full strength or whether they're lacking a little bit. We tend to compare one side to the other, so we don't often compare patient to patient, although sometimes we do, but it's always useful for us if we compare your left side to your right side to see what it should be. So then I'd probably work more on some hamstring stuff, some hamstring strengthening and that kind of thing. And then sometimes if it's a case that your movement is restricted, then sometimes a bit of soft tissue release as well to help with that movement.
Yeah, fantastic. So yeah, I think we've covered there sort of what we would do in an assessment. So we're definitely looking at recognising their mechanism, how that may have impacted, looking at the type of pain that gives us a lot of clues on what might be causing it, and then really looking specifically at someone, not just a blanket, this is your sheet of exercises, but saying, okay, so what is the relationship between the quads and the hamstring? Where is the tenderness coming from? And understanding as physios, you know, however much we want to be really specific, the evidence sometimes says that you can't be specific. So we have to look at what we've got, and we've got to look at the individual and say, right, this is their goal, how do we get them there?
Yeah.
Right, I think we'll wrap that up. Is that okay?
Yeah.
Cool. All right then, thank you for joining us on our Physio Crew TV. We'll see you in the next episode. Take care.
Bye.